Welcome to everybody who has joined today. Thank you so much for your time to watch and listen. You have joined our webinar about the 7 fundamental elements of an effective compliance program, or how does healthcare compliance pros help organizations to be able to comply. I'm your webinar host. My name is Cameron McNerney. I'm the Communication and Product Manager at Healthcare Compliance Pros, or HCP. Um, in we're we're discovering more and more that, with healthcare compliance, where do you start? It's really as basic of a question as that. And so today we would like to help you to know how to build an effective program that helps you to understand and then to meet your requirements. This means HIPAA, OSHA, corporate compliance, human resources, coding and auditing, and more. And today we're going to expound on some of those topics that we believe are going to be most relevant to you. Before we inform and educate you, let's go over some quick instructions for today. If you would like, you can request a slide copy. We can send you a PDF copy of this presentation. The contact info is going to follow. We have 3 compliance questions in this presentation. Just make a mental note with some honest responses. It's going to kind of help you to know where your compliance program is today. And then you're watching it, you can be able to watch it again on demand and be able to learn at your speed. And with that, allow me to introduce to you our speakers. Megan Toombs first. She is the Director of Client Services at Healthcare Compliance Pros. She has over 15 years of experience consulting with companies to find solutions that improve their day-to-day operations. Now, for the last 5 years, her focus has been working with healthcare compliance practices, or healthcare practices rather, to help simplify their compliance. Megan is a certified healthcare compliance professional. She's helped thousands of organizations by providing solutions, resources, and tools that help clients to sleep better at night. Jake Yates is a client services executive at Healthcare Compliance Pros. He has over 10 years of experience with a background in Medicare compliance and audits. He specializes in risk management, RAPS, and EDS claims and submissions, Medicare general healthcare compliance. Jake, he's the guy to talk to for first-hand experience with handling OIG audits and compliance. During his time at HCP, he's helped hundreds of organizations to avoid audits and expensive fines for non-compliance from the OCR, OSHA, and the OIG. Jake has a master's of business administration and healthcare management, a bachelor of social work, and is a certified healthcare compliance professional. And with that, I'd like to turn the learning objectives over to Megan. Megan, are you ready to inform and educate us today?
Absolutely. Thank you, Cameron. And thanks everyone for taking time out of your busy schedules to learn more about the 7 elements of an effective compliance program. Our mission as a company is to help organizations not only understand their responsibilities and what's trending in the compliance world, but also to provide a solution complete with the tools and support to help successfully mitigate risk to your organization. Over the next 30 minutes or so, Jake and I are going to spend some time talking to you about what makes our company unique. We'll also discuss what we've found with regards to compliance being a high overhead, low reward liability for healthcare organizations. And we'll do a deeper dive into the 7 elements of an effective compliance program and how to incorporate those into your day-to-day business operations. So first, let's talk about the HCP difference. Most of the time when a company or the individual in charge of compliance is looking for assistance with compliance, they either find a consultant who they work with to create policies and procedures, a compliance plan, and maybe some training for their staff, or they go the route and find a software program that can automate compliance. We've identified a gap between the two. With the consultant side of things, they're often left without a way to automate aspects of compliance, which obviously impacts their time. On the other hand, with the software, they have all the automation in the world, but the burden isn't removed because they still have to do research and create a compliance plan to meet their requirements. So at HCP, we've combined these two worlds together. We have a team of compliance experts that help our clients create a compliance program and a plan to meet their individual needs and provide support. So if any compliance questions or needs arise, our best-in-class technology also provides the automation component to keep everything up to date and remove the burden that comes with monitoring everything manually.
Right, Megan, and to give a little more context into HCP and where we come from. So we've been in business for over 11 years, began in 2011, and currently we provide compliance services to over 4,500 offices throughout the United States. One of the things that makes us truly unique is our audit assurance package and the protection that it provides. So we provide $1 million of audit protection for you. Although we can't prevent organizations from being audited, if you do receive a fine as a result of a failed audit, even after following our program, we will cover that up to $1 million. Now, when we look at some numbers about compliance, we see a few things. Over the years, as we've gone to conferences and been involved in associations, we've used these opportunities to conduct surveys and really get a better understanding of where people are at when it comes to compliance. What we found is about 3 out of 10 folks can confidently say they know their requirements, but then 1 out of 10 of those can't say they're meeting them. Some of the most common things that we typically hear are they have too many hats to wear. I have too many hats to wear. I don't have enough time. There's not enough clear guidance on what I'm supposed to be doing. And with that, Cameron, I think it's time for our first poll question.
Thank you, Jake. So just internally, question yourself, your organization's compliance program. When was the last time that your policies and your procedures, when were they last reviewed? When were they last updated? Was it 12 months ago? Was it between a year? Was it more than 3 years, more than 5 years? Or perhaps you're just starting and you haven't been able to do this yet. If you would like more time to think about this question, please take a moment to pause the video. Otherwise, let's continue with putting this into context. Jake, what would be your recommendation for updating and reviewing policies and procedures?
Cam, one of the most important things in doing that is knowing that you have everything you need in place and making sure it stays accurate. In fact, we've found a widespread misconception that training your staff and having policies and procedures in place is what makes an organization compliant. And that's just not the truth. So using our proprietary compliance program, we've been able to reduce the risk of fines and other issues by up to 90%, honestly. And that is through implementing a comprehensive compliance program. And that's a vital part of the process, is having a comprehensive program. So let's discuss where the 7 elements came from and how it became such a popular guide for healthcare organizations to follow. Starting with the requirements from CMS. But first, let's go ahead and take another poll and see how many of our webinar participants have heard of the 7 elements.
Absolutely. If you are watching this for the first time, just ask yourself internally, have I heard of the OIG or the 7 elements? And then let's continue on with educating our users about the OIG and these 7 elements.
Thanks, Cam. So looking at the 7 elements of an effective compliance program, some of you may be wondering, where did this come from? How did it come about? So quick backstory to that. In the late 90s, early 2000s, the OIG started publishing documents to help organizations develop effective compliance programs. Then when we kind of fast forward another 10 years or so, when the ACA, or Affordable Care Act of 2010, became law, it actually mandated that all participants be involved in a compliance program in order to provide services such as Medicare or Medicaid, or some of the plans on the marketplace. Compliance became a true requirement at that point for them. And then finally, fast forward to 2017, this is when the OIG published this document and these elements, the 7 elements of an effective compliance program. The document really reaffirmed that an effective compliance program needs a few things. It needs to be scalable, needs to be customized, and it needs to become part of the daily operations of any healthcare organization. And this goes from the CEO all the way down to the receptionist. There's no one exempt from being compliant. And without further ado, Megan's going to introduce us to the 7 elements of an effective compliance program.
Thanks, Jake. Thank you, Cameron, for those awesome questions. Our company, we've really built our foundation upon these 7 elements. And so I'm excited to introduce you and give an overview of each one. So what Jake is describing is what he mentioned, the document that was put out by the OIG in 2017. And the elements that they put in that document are first, customizing and creating policies and procedures for your organization, designating a compliance officer, providing workforce training, having an anonymous compliance hotline, doing internal monitoring and auditing on your compliance program, enforcing the standards and policies that have been created as part of this plan, and then having a plan and documentation in place for corrective action. So what we'd like to do is take a deeper dive into each component and talk to you about the recommendation and guidance from the OIG, along with the tools and resources the HCP has to help you fulfill each one. Hopefully we'll be able to simplify this, cut through the noise, and give you some information and resources to help as you're assessing and looking through your own compliance program. So it's really important, first of all, to have written policies and procedures that aren't only unique to your organization, but also to each location within your organization. This is so employees know what to expect and can refer back to those policies anytime. So this not only applies when they're wondering what benefits the company provides, but also when they want to understand something like maybe evacuating the building to avoid chaos in the case of a fire or a natural disaster, or even how to protect patient information from being seen by the wrong person or stolen. The list goes on for the various items that you might want to discover in the policies. But staying up to date on those policies, and especially as things change, as the environment changes, super important. We recommend reviewing the policies regularly just to ensure that they reflect the most up-to-date requirements and day-to-day practices. Jake's going to spend a couple of minutes here talking to you about how we can help you with the policy and procedure component of the 7 elements.
Thanks, Megan. So as part of HCP's program implementation, our compliance advisors work directly with our clients to customize and create written policies and procedures that are unique and specific to your organization, even down to location specific. If you've got multiple locations, we want to dive down because we understand that even within one organization, not every location is going to be operating the same. So these policies are available in our online platform at any time. Since it's software driven, day or night, you can access that information. Let's go ahead and look at the second element now, the compliance officer and a compliance committee.
Thanks, Jake. So spending time designating a compliance officer for your organization means that you have someone paying attention to your compliance requirements and also ensuring that the obligations there are being met. So this person should be named in the policies and procedures and referenced in any training so that if the employee has a question or concern about a policy, they know who to direct those to. Unless they want to, so if they do have a question that they want to report anonymously, we'll spend some time and get to that later in the presentation. But Jake, can you give us some details just on how HCP can help with the compliance officer component of this?
Yeah, absolutely. So one of the things that we'll do is we'll work with you to evaluate and really designate who the compliance officer should be, and really who should be on that compliance committee and team, if that's something you've not done already. Maybe it's time to reevaluate that and see where you're at. So in essence, we view the compliance officer as a liaison between your staff and our compliance team here at HCP. Basically, that means if your compliance officer, or really anyone, has a question and they're unsure of how to answer something or need help handling something, our team's there as a resource and as a support. The compliance officer is just simply someone who oversees compliance within the organization. And one of the items a compliance officer needs really is to keep track of is employee training. That is a vital part of it. Megan, will you tell us a little bit more about what HCP does for training?
Yeah, for sure. So one of the things that we hear most often that Jake alluded to earlier in our conversation is the fact that training is one of the items that practice managers and others believe is the core part of a compliance program. And they're right about that, but it's not the only thing that is required in order to make an organization compliant. So we see training as obviously one of the steps in order to get there. Educating your workforce on the policies and procedures that you've now created and written down is obviously an important step in becoming compliant as an organization. We found that you can reduce your risk of exposure significantly just by making sure your employees are up to speed on your protocols and processes. Having documentation to prove that every staff member has been trained is also a crucial element in providing compliance in case of an audit, survey, or other inspection. The training content should be reviewed regularly and added to as regulations are updated or changed. So this is something that is an undertaking on its own, checking to make sure that there are if there are updates and getting that content updated. Jake's going to talk to you a little bit about how HCP can help with this component, and then especially what we can do to help support you in the updates and the ongoing education as well.
Absolutely, Megan, and that's a great point. Compliance, we know, is a moving target. It's constantly changing and morphing, and having a team of people that are watching those things constantly, it creates a great resource for you to be confident in knowing that your training content is always up to date and accurate with the latest in compliance news and really in healthcare news altogether. So in addition to the required compliance trainings, we provide a course library that offers over 130 other training courses to help meet compliance requirements, to provide continuing education for your providers and clinical staff, even down to the ability to create your own coursework to address your unique training needs. If you have, for example, maybe a new process in place or a new program you're using, you can create a training with video, audio, pictures, and then use the program to track completion dates and send out reminders and give you a place to easily manage your employees' training and making sure they're taking it in a timely manner. Some employees have questions or concern about compliance after their training, and having a place where they can really ask those questions or report concerns is really another key part. And the next part we'll look at in an effective compliance program.
Yeah, thanks, Jake. So having a compliance hotline or a place for employees to go to voice concerns, to ask questions, it really is another key element in an effective compliance program. The hotline should be internal, and as each submission is investigated, progress should be recorded so that if the time ever comes where you have to show what the problem was and what was done about it, you have all of the documentation to support your response. Giving employees the ability to report things anonymously will allow your leadership team to gain insight into areas that may be confusing or lacking, and will ultimately support you in creating a culture of compliance.
And that's an important thing to draw out, Megan, that you just mentioned there, is creating that culture of compliance. That's really a vital part of a good compliance program. And like Megan mentioned just a minute ago, one of the key requirements of an effective compliance hotline is the anonymity. It's so important to document each issue, but also to make sure that that remains anonymous. And the documentation part of it really needs to go from the initial report all the way through resolution of the issue. So aside from the ability to track questions or concerns, a compliance hotline also gives you the ability to see trends. So for some of you, the idea of maybe being responsible for handling all these questions and concerns feels a little overwhelming. You're not alone. This is one of the many reasons why, again, we have that team structure in place, why you have compliance experts at your fingertips to help you every part of the way. If you have questions along the way, your team of experts can help you craft responses back. They can provide resources to assist you and really give you any further guidance on the steps you need to take to resolve any issues that may need to be reported. So let's do a quick recap really fast of what we've covered so far.
Definitely. We'll spend some time doing a recap, and thanks for what you shared about the compliance hotline. It is super important that you know that your compliance team here at HCP have seen it all. We have, as we've mentioned before, we've been in business for over 10 years, and we've heard about every compliance question and scenario you could think of. So don't hesitate to reach out to that team, and they're happy to help and provide you with some resources and tools to help you out. So just to review, just kind of where we're at so far. So first, policies and procedures are created. All the employees at the organization are trained on those specific policies. Someone's volunteered as tribute to oversee compliance. A hotline is created so questions and concerns can be addressed. What else could you possibly need, right? So this part of the program is one of the many things that sets us apart in our space. It's one thing to write down what you're doing, and it's quite another to make sure that you're actually doing it. So periodic auditing or assessment of your day-to-day practices within the organization with the intention to find gaps between what was written and what's actually happening will allow you to identify and document the areas that need improvement. If you're feeling like that in itself is a task, you're not alone. It happens. We're human beings. It's been said that compliance is not a sprint, it's a marathon. It isn't about being perfect in every aspect of compliance at all times, but it is a matter of being aware of what you should be doing, documenting the deficiencies you've recognized, and then making a plan to improve on those areas. Jake, talk to us a little bit about how the team can help our clients and prospective clients with this process.
Yeah, absolutely, Megan. And the internal monitoring and auditing is one of those things, again, that makes HCP's offering truly unique. So we have the tools and resources there to help you get everything in place. But part of that is really making sure that what's written down or what's being trained on is actually happening in the day-to-day operations in your organization. So the assessments and tools that you see on the screen allow you to conduct an analysis of each aspect of your compliance program, HIPAA, OSHA, corporate compliance, to determine whether your daily practices actually reflect what's written in your policies. One of the most important assessments a healthcare organization can complete is the security risk analysis for HIPAA compliance. About 70% of the practices that we've seen would outright fail a HIPAA audit just from an insufficient security risk analysis. One of the most vital pieces of that process is making sure your SRA is comprehensive and detailed. And that's really the key point to a successful HIPAA compliance program. And with the support of the HCP team, we'll be here to help you to ensure that SRA is sufficient to pass any type of audit that may come your way. The other proprietary assessments that you see there on the screen provide everything you need to really ensure that you are compliant. In essence, you get to put on the inspector or the auditor's hat and conduct the audit yourself. So these assessments are built to help reduce your risk of an audit and truly prepare you for any inspections that may come your way. And on the flip side of that, you should make sure you don't forget about the coding and billing piece of it. So it's a very important thing to monitor and audit your coding and billing frequently. I've seen firsthand some of the issues and fines that come from overcoding and overbilling. Actually, at a previous employer, I had a health plan client who was audited by the OIG for suspected fraud and ultimately was fined about $7 million for overcoding. The alarming part is once they were fined, they actually started lawsuits against each of the individual providers whose charts were overcoded and ultimately caused the health plan to be fined. So HCP's compliance risk analyzer software really allows you to see how the OIG and payers view your providers and your organization. In essence, you get a glimpse at what you look like from their perspective before they even see what your risk looks like. And really, in addition to finding areas of risk, the compliance risk analyzer also identifies areas of lost revenue from underbilling and undercoding. So at the end of the compliance risk analyzer analysis, one of our experts here will personally review the results, and then they'll provide specific guidance on how you can retrieve that lost revenue and how you can rectify any overcoding or overbilling as well. It's great to have these tools and resources, but they really won't do you any good without enforcement, right, Megan?
Absolutely. Yeah. So the next element really is around enforcing the standards. So now that you've identified what's been written and trained on and assessed what's actually happening, including, like Jake was saying, the coding and billing side of things, you now have a better framework for which policies you need to focus on enforcing. After all, what's the point in creating a plan that isn't being adhered to, right?
That is so true, Megan. No point in that plan at all. So along the same lines with that, HCP will not only provide the guidance, but if you ever have questions about how to enforce your compliance program, the team here is there to help provide those recommendations and answer those questions and address your specific issues about your organization. We also provide multiple other services you see on the screen that are there to help enforce your policies. Tools like our business associate tracking and credential management tools allow you to track and store information, maybe a BAA or a contract or a medical license on each of your business associates and your employees. So in essence, it provides a one-stop shop for all of this important information. We also provide tools like a self-maintaining virtual safety data sheet binder. Background checks are another important one, and acknowledgement tracking, really to help organize the practice and put everything back in that one spot. And with that, let's go ahead and look at the seventh and final element, corrective action plans.
So I've said it a million times. Compliance is all about documentation of your due diligence. This is especially true when it comes to corrective action. So like I said before, it isn't about being perfect in all aspects of compliance. It's about showing that the organization and those in charge of compliance care about it and that you're willing to put processes in place to make sure the rules are being adhered to. Documenting what you're doing and especially when that's not the case, will only benefit your organization if you do have a call from the Office of Civil Rights or those other governing bodies. So talk to us about how we can help with the corrective action plans and especially the documentation of those.
Yeah, absolutely, Megan. So many times our clients are really unsure about what's missing or what documents they need to use for their corrective action plans. So again, the team's here to support and help you understand what corrective action plans should look like and what they should include to be effective. We can also provide recommendations on where to store this information so you can quickly access it whenever you need to. Documenting instance and corrective action plans really shows auditors your intent to be compliant. We understand and absolutely get that HIPAA breaches and accidents happen. They are truly unavoidable. The most important thing you can do to remain compliant is to thoroughly document what's happened. And this includes all the steps you've taken to correct the situation as well. So HCP again provides a breach mitigation service that's there to help you for any confirmed or suspected HIPAA breaches and make sure those are quickly and correctly handled and reported. In fact, actually thinking of that, about a year ago, we received a call from an office manager of a small practice, under 10 employees, very small. And part of this practice manager's responsibility was to securely email patient charts over to their surgery center that they worked in conjunction with. Unfortunately, a hacker was able to get the secure email password just for the practice manager, and they stole patient records for over a month before anyone noticed. So this small little family-run practice had over 500 patient charts stolen, and then had to report that to the OCR and all the patients involved, and announce it on the local news media as part of the requirement for reporting. So corrective action plans are there to help prevent small issues from becoming big problems, right, Megan?
Absolutely. Yes. Thanks for spending some time talking about that, Jake. It's happened time and time again, and each time we hear from especially the smaller organizations that they're exempt from some of these things because they're small. It's not that we're trying to instill fear in anyone. That's not our intention, but we are the people that they give a phone call to when they are in these situations. And so our biggest goal as a company and our mission in this is really to help protect private practices and providers, from having any types of issues when it comes to either the coding and billing side, or breaches and accidents and other things that can happen. So I just want to thank everybody for your time, spending some time learning about the 7 elements of an effective compliance program. There is obviously a lot that goes into maintaining each of these elements. Like I said, one of our biggest missions in this is to provide the tools and the support for you to be able to ease that burden and allow you to clarify your requirements, help you understand exactly what you need to be doing, and then to ultimately protect you from anything that may happen as a result. So as far as what makes things difficult, we're definitely on the same page with you, and we've spent over a decade trying to perfect the program to include all of those key components, including the support and the internal processes to help meet the needs of each one of our clients. Again, thank you for spending some time with us this afternoon. And Jake, was there any final thoughts on your end?
Yeah, Megan, I just want to actually echo what you've said. Again, everyone, thanks for your time today and spending it with us. And we really hope it's been a valuable use of your time. If you're out there and you're interested in learning more about your specific organization requirements, or really if you want to explore the program more in depth, we're really happy to schedule time to meet with you one-on-one and discuss your unique needs and see how we can help. We'll include some contact information and a link to schedule some time with client services executive, myself, or one of my colleagues in our post-webinar email, so you can access our calendar that way. I'll go ahead and turn it back over to Cameron so we can open it up for our final poll question.
Thank you, Jake. The last compliance question that we would like you to consider internally is, what is your greatest challenge to assessing your compliance program, or rather performing a high-level compliance program assessment? Is it because you don't have enough time? Is it because you just don't have the resources, the tool, or maybe you're lacking the knowledge? You don't have commitment supporting you, you have a lack of institutional support, or maybe it's something else. But recognizing the challenge is the first step to building an effective compliance program. And to summarize what you have available, it's easily summarized as: HCP is here to help you to understand and to meet your compliance requirements. That means HIPAA, OSHA, corporate compliance, human resources, coding and billing, and other very important areas. And we can take a quick recap of just like what's occurred on this webinar. Is the key difference is our combination of expert support. This is live people, live compliance advisors, and then they're powering an all-in-one software platform, and it's going to help you to manage your compliance program. And everything that we do is built around the 7 OIG elements that Megan and Jake have taken time to explain and to share with you the importance of each one of them. And so not one, not part, but all of it, the capital C of compliance, we include this into our HCP portal. And the way that you can think about it is our compliance software, our dedicated compliance advisors, every step of the way is helping you to not have to worry about managing each one of those OIG elements. Now, how do you access this? If you're an HCP client, you already have access. Just log in to the HCP portal, or you can contact your dedicated team of compliance advisors. If you're not an HCP client yet, really the fastest way that you're going to be able to learn more about building an effective compliance program for your unique needs is by scheduling a free online consultation with us. An executive like Jake, a director of client services like Megan, is going to help guide you into what are your needs, and then how can we build a program that keeps you and your organization protected. Now, that being said, if you were just wanting to learn more on your own, there is a free resource that's available to you that the OIG has created. Now, I just wanted to make sure to give this to you rather than you wasting 30 hours of a week trying to look for it. The government is not always obvious in its resources, and our goal is to help you to save time. So we want to just share these questions that they're going to help you to evaluate your compliance program on your own. Meanwhile, if you do have any remaining questions, either about the OIG, about the 7 elements, or just what compliance regulations really apply to you and how can you meet them, Megan Toombs or Jake Yates, they're ready. They're willing to help you to build that effective program. And so just remember that if you're looking to simplify your compliance, contact Healthcare Compliance Pros. In the meantime, thank you for joining our informative webinar about the OIG's 7 fundamental elements of an effective compliance program. We hope that you have a successful week.